So actually this is an X-ray of my pelvis. So 7 years ago I was diagnosed with a condition that left the blood supply to my right hip. It severed the blood supply to my right hip. So for 7 years I suffered with chronic pain. This gave me the opportunity to understand what pain is. It's all engulfing, and it's not just physical. It turns your life around, inside out, upside down. It basically controls you. Luckily, last year I was able to get a metal implant, which is sitting right here at the moment, and I'm relatively pain-free. But this is the reason why I chose the project with SBYM, which is palliative care in Mysore. Okay, so what is palliative care? Palliative care is an approach to care. It's a holistic approach to care that doesn't just look at a number of organs. It doesn't look at a disease. It looks at an individual and their family, and all the issues that could go along with that. That could be, that's obviously the physical, but in addition to that, it's the psychological, the social, the economical, and it starts at the point of diagnosis. So, I just want to give you an example. This is Ratnama. So she has adenocarcinoma of the stomach. It's not curative, it's palliative. When we met her, she was suicidal. She couldn't walk, she was crying, and we actually went to her house, and she just cried. And she just said, the pain is so much, I just want to die. And yeah, so, you know, what can we do? So initially, what palliative care approach, what the program attempts to do is, initially it's pain relief. Before we do anything, if we don't address the pain, then actually nothing else can be done. So first it was pain relief and nursing care. So this is the medical part. This is the part that most hospitals can deal with. But after that, it's a lot more. You know, we realized that she had anxieties to go to the hospital. So we have a staff member based in the hospital just to take individuals for their chemotherapy, just to take individuals to go and get their blood tests. We also linked her, her husband is a sweeper, Anand. He earns 3,000 rupees a month. Chemotherapy costs 7,000. So we were able to link her to a government scheme from Mysore. The Mysore Corporation were offering 10,000 rupees for any families who are suffering from chronic disease. We also realized that she doesn't have lighting in her house, so we're trying to link her to solar lighting. We offer weekly counseling. This is about the condition, how to care, also about nutrition, what you should be eating. When we met her, she was chewing tobacco. We said, stop chewing tobacco, please. The following week, we said, you stopped chewing tobacco. She goes, yeah, I've given it to my children. So, I mean, we laugh, but it's shocking. You know, we take these things for granted. So it's actually sitting down, what do you understand about your condition? What do you understand about what's going on? And like, what can we add to that? What do you want to know? Also, she mentioned that while she's on chemotherapy, they don't have enough money to eat. For 3 days, her two sons, so this is Raju, and her other son is Harish, I think. Yeah, Raju and Harish. They both went out without food for 3 days. And so, through community contributions, we are providing some of our families with like a food kit. So it's rice, dal, ragi, and we give this once a month. And we also, speaking to Raju, we learned that he he missed school because looking after his mother for chemotherapy. So we also are trying to provide a mentorship scheme for Raju so that he can pass 8th sem. So why is palliative care needed? It's because of someone like this. This is Tanushree. She's a 1-year-old child, and she died last Sunday. The reason she died is because her parents couldn't afford treatment for cancer. The saddest thing is, that treatment was free. There's an NGO in Delhi that's offering free treatment for children called CanKids. But nobody told them, nobody linked them. This is something that could have been prevented. This is someone who fell through the cracks. So what were our biggest challenges? Our biggest challenges as a program I have to say, so we have 47 families that we're supporting. So Ratnama is one of 47 families and 33 bereaved families. Our biggest challenge was funding. I'm sure many NGOs face this. So actually, our biggest challenge was also one of our strongest driving forces, because we were able to integrate volunteers from all levels of the program. At the moment, we have 27 volunteers, 12 of them are doctors. We have 2 volunteer drivers who will transport the team free to the areas that we're serving. We have somebody collecting medicines from the district hospital. We have someone collecting grains, and we have a photographer, somebody helping with the website. So by having a team of volunteers, we've also ensured sustainability. So this year's been an incredible year, an incredible journey for me. I think palliative care, people have been dealing with the harshest truths that they could deal with in their life. And that made me, it basically put a mirror up for me. And like, you know, really, how am I living my life? How do I want to live my life? And there have been many times this year that it's been really difficult. Manojbhai will probably confirm that. You know, and yeah, there are times where I'm just like, why am I here? What am I doing? But actually, it all came down to just being really honest with myself. Like, did I think it was going to be easy? No. Did I want things just to go my way? No. Did I come here to serve? That was basically what I said.